Hi guys, we're going to go over chapter 20. This is your next to last chapter, and chapter 21 is relatively short. So you guys are so close to the finish line. Just keep going and you're almost there. All right. Let's get chapter 20. All right. This is childhood diseases and disorders. This kind of piggybacks on the last chapter that we talked about. There are different categories: viral, bacterial, fungal, and parasitic. We've kind of talked about some of these things before. Some infections can be prevented by immunizations. We've hit on that before also. Many of these are going to have an incubation period. They're going to have fever, generally not feeling well, coughing, not wanting to eat, nausea and vomiting. Some may include a rash. The treatment's going to depend on what the disease is, but it's often going to just be taking care of the symptoms, whatever they're feeling, and making sure you're washing your hands and cleaning things up really well. Viral diseases are usually symptomatic treatment. They're not going to be antibiotics. We've talked about that. They can invade the host and lay dormant, and they can be reactivated by certain triggers such as stress. So you may get something and your whole family, or something may be going through your family, and you think, I didn't get that. And then a couple weeks later, all of a sudden you get it. That's because it was laying dormant in there and you got stressed somehow, or something happened in your body. Or maybe it is that you were just so overly stressed, your body was like in fight or flight mode, and you were not going to get sick because you were caring for everybody else. And then you start to relax, and all of a sudden your body's like, oh, okay, now I have time to be sick. Measles, this is also known as rubeola. This is one of the most serious childhood diseases. I don't know if you guys have seen, but this is making a comeback, and I can't remember where it was at, but somewhere they said people are again dying of this. Children, it's terrible. Symptoms are going to be fever, runny nose, a rash, and Koplik spots. There's the measles rubeola rash. There's those white Koplik spots. Rubella is a type of measles. This is also known as the German measles or 3-day measles. In pregnant women, this can lead to birth defects, and it is less contagious than rubeola. They're going to have lymph node enlargement, nasal discharge, joint pain, chills, fever, but children and women of childbearing age should be immunized. And there's the rubella rash. Some of these pictures are old because we had gotten rid of them, but now these things are making a comeback because people are not vaccinating. Mumps is an inflammation of the parotid glands. Symptoms are chills, fever, ear pain, swelling. You can have deafness from this is one of the complications. There's the mumps, poor baby. Varicella, also known as chickenpox or herpes zoster, is highly contagious. When I was little, they did chickenpox parties, but it's a rash, itchy rash. You're going to get a rash on your face, trunk, and extremities. I had this as a child. My youngest daughter, interestingly enough, had the vaccine and also got chickenpox. Not from the vaccine. She got it about a year or two later, but it was much milder than I think it would have been had she not had the vaccine. Polio is caused by the polio virus. The immunizations have reduced the threat of this disease. There's some varicella pictures for you. You can see the little pustules on there. Look, they're having to hold that baby's arms down because probably scratching. Influenza, this still affects us today. This is a viral disease. It's acute infectious respiratory disease, occurs late fall through early spring. Symptoms are going to be a sudden high fever, dry hacking cough, chills, headache, joint or muscle aches. We've talked about this pretty much in depth. And prevention is the vaccine, although it's not 100% guarantee. Common cold is the most frequently occurring disease. It's caused by the rhinovirus. The best prevention is good hand washing. And again, I'm sure you'll see that pop up on your final. RSV is an infection of the airways. It's the most common cause of bronchiolitis and pneumonia in infants. It is caused by the respiratory syncytial virus. Symptoms are cold-like, but these are little babies under the age of 6 months, and they usually are going to end up being hospitalized. Fitz disease is a contagious viral disease common in children. It's caused by the parvovirus. Symptoms are a red rash on the face, fever, runny nose, and swollen joints. My daughter had this. Mononucleosis primarily affects children and young adults. It's caused by the Epstein-Barr virus. They're going to have fatigue, sore throat, fever, swollen lymph glands. This also used to be caused the kissing disease. AIDS, we've covered this pretty much in depth, but again, it is a viral disease, but there is treatment now. Bacterial diseases are usually caused by staph, strep, Clostridium, Haemophilus. But again, I don't work in the hospital, but they're going to have cough, fever, headache, difficulty breathing, sore throat, and they're going to treat it based on what's causing it. Pertussis is a bacterial disease. This is also known as whooping cough. There is a vaccine for this, and these babies and kiddos get this violent whooping cough. Diphtheria is a severe inflammation of the respiratory symptoms. It was a leading cause of death in children, but now it's rarely seen. Tuberculosis most commonly affects the respiratory system, increasing number of cases in children. Tularemia, this is also known as rabbit fever. It's transmitted by the bite of an infected animal, and the prevention, of course, is avoiding tick bites, but this still is a thing. Impetigo is it's contagious. It's caused by staph and group A strep. When I was little, they used to tell us that we would get this by picking our scabs. I don't know if that's altogether the case, but it has crusty yellow lesions once it turns into impetigo. Good hand washing prevention. Tonsillitis. This is an infection of the tonsils, and it's mostly caused by strep and antibiotics and getting your tonsils removed. Otitis media is an acute bacterial infection of the middle ear. If it's untreated, a chronic infection develops. It's pain, fever, ear drainage. Actually, my daughter just had a double ear infection and has lost her hearing temporarily. We're hoping it's going to come back. Fungal diseases affect the skin or the mucous membranes in children, and it's usually not severe, but it can be irritating, and they may need medical attention to prevent the spread. Yeast infections are common in infants' mouths. It's often called thrush. In the diaper area, it's called diaper rash. This is a fungal infection, though, and thrush can be prevented by breastfeeding, but breastfeeding infants can still get this. But it is common in infants, and diaper rash is treated by keeping the area dry and clean. But sometimes with infants, you can't prevent it. Diaper rash. You can keep them dry and clean, but if they get diarrhea or loose stools, they're almost always going to have some form of diaper rash. Tinea is also known as ringworm. We did talk about this. We talked about the different kinds. Parasitic diseases are caused by organisms that feed on another organism. We're not really going to go too in depth about this because we've already talked about it. Giardia is a protozoa. It's young children are most affected, and it's going to lodge in their intestine. They're going to have some stomach problems. Head lice, we talked about this a little bit. These nits are lice eggs. It's a problem, and they are becoming somewhat resistant. We've talked about that. Pinworms, roundworms, all not good. Respiratory diseases are the most common childhood diseases seen by physicians. Infants are most susceptible. Sudden unexpected infant death is SIDS. This is an unknown death, unknown cause, and it's going to be abrupt, unexplained death. They say infants under the age of 1, but I've seen it die. I've seen that in older children too. Croup affects children ages 3 months to 3 years, and their symptoms are going to be stridor, and this one can be pretty severe. You can have an enlargement of your tonsils and adenoids. We've talked in depth about asthma. Pneumonia, we've talked about. But there can be a viral pneumonia, and you don't want to give an antibiotic if it is viral. Children can experience serious developmental problems due to a lack of appropriate ingestion, digestion, absorption, or elimination. These can be caused by vomiting and diarrhea. You need to be sure that kiddos are taking in adequate nutrition, so that's kind of hard. But electrolyte imbalances can be severe and can cause severe problems. Can be life-threatening when it's dehydration. Want to make sure they're crying, tears, and going to the bathroom. Food allergies are common nowadays, more common nowadays than they used to be. And if an allergy develops after age 3, it usually continues into adult life, but many disappear that are those young ones. Eating disorder is a major problem among children, especially adolescent females. Most common types are anorexia and bulimia. Most cardiovascular diseases in children are related to genetic or developmental disorders that we talked about in the previous chapter. Musculoskeletal diseases are common in children due to high activity levels and range from soft tissue injuries, fractures, deformities, degenerative muscle disorders. Reye's syndrome is an acute encephalopathy in children under the age of 15 who have a viral infection. There is a relationship between this disease and the use of aspirin. And in the last class, I did have somebody who did not know that. And so it is important for children, I believe it's under the age of 15, but I still don't give my son aspirin. Especially, I would say under the age of 18 to not have aspirin, because you just don't know if they're sick or if they're developing something, and then it can turn into this Reye syndrome and can cause death. So children should not have aspirin. There are trauma, unfortunately, and in our field, we see this more than average. And this is a serious problem. It can be fatal. There is different types of abuse, and sexual abuse is more prevalent than what any of us would like to think. Suicide is the second leading cause of death among young people, unfortunately, and early intervention is what they're talking about being the most important. Drug abuse, they're trying to get away from the word abuse and saying misuse, but there's many different types. Poisoning is still among the top 5 causes of accidental death under the age of 10. Most poisoning are due to common substances, things around the house. All right, guys, that's your next to last chapter. Your next one's pretty short, so let me know if you have any questions about this, and you can either post them or email them to me. Have a great day.